we can observe two different profiles. On the left side, we have a patient who suffered acute hepatitis B and recovered completely. On the right side, we have the opposite. We have a patient who suffered acute hepatitis B but couldn't recover, and he became chronic. So on the left side, recovered patient, on the right side, chronic patient. For the diagnosis of hepatitis B, at the Laboratory of Microbiology, we are going to use serology. And we are going to test some markers of infection in blood. The Laboratory of Microbiology, we are going to test the surface antigen, antibodies against the surface antigen, and antibodies against the capsid, against the core. Okay? By the way, these total antibodies against the core, when I say total means IgM and IgG at the same time. Okay? So we are going, these three tests are the tests that we use for the diagnosis of hepatitis B in the beginning. Okay? And we can find different outcomes, different profiles. For example, a patient whose these three tests are negative. This patient has never been in contact with hepatitis B virus. So this is a susceptible patient. Never in contact with hepatitis B. Second profile that we can find is a patient in whose only antibodies against the surface antigen are positive. Remember, these antibodies are the only antibodies that can protect someone against hepatitis B. So this patient is protected against hepatitis B. But this patient has never been in contact with the virus. This marker, antibodies against the capsid, is the marker of contact with the virus. Because this marker is negative, this patient has never been in contact with the virus. Only antibodies against the surface antigen. So this is a vaccinated patient. This patient has been vaccinated, but this patient has never been in contact with the virus. Another profile, antibodies against the surface positive. So this patient is protected against the virus, but in this patient, the total antibodies against the capsid are positive. So this patient is also protected, but this patient has been also in contact with hepatitis B virus. So this patient, this profile is the typical profile of a cured patient, recovered. This patient suffered hepatitis B, but this patient recovered completely. So this patient is protected against hepatitis B. Look the difference with the other profile. Both are protected, but one because of vaccination, the other one because of infection. And finally, we have a patient with the surface antigen positive, antibodies against the surface antigen negative, and antibodies against the core positive. So this patient is not protected. This patient has been infected by hepatitis B virus, and this patient is currently infected because the surface antigen is positive. So current infection, this patient is suffering hepatitis B right now. Acute infection or chronic. This is the marker of current infection, surface antigen positive. And finally, the last profile that we can find at the Laboratory of Microbiology is this one. Only antibodies against the capsid are positive. This is difficult to understand. This is difficult to interpret. The interpretation of this profile requires another class. We need a seminar for understanding advanced serology against hepatitis B. Last year, We had a seminar in summer to explain serology with more detail. Hopefully this year, we will have another seminar in summer, not yet. So this profile may show different possibilities that we are not going to study. So this is an indeterminate profile. The other profiles, these four, must be understood perfectly, okay? Do you have any question about serology for hepatitis B? This is the most important part of the class. Any question? Oh, do you want to say something about serology?
Tụi em có câu hỏi gì không ạ?
Chắc là không rồi cô.
Cô nói sơ về cái lúc nãy các bạn có hỏi về cái là lúc trước thầy có giải thích cho các bạn về các cái loại kháng thể các bạn. Thì vì lúc nãy các bạn hỏi là cái kháng thể HBC á, thì nó xuất hiện thì cái kháng nguyên của HBC nó có mất đi hay không? Em ta nhớ lại là trong các cái kháng thể mà cơ thể chúng ta sinh ra thì nó có 3 loại là HBs, HBC và HBe. Thì trong cái 3 loại đó nó chỉ có cái cái kháng thể là HBs là có vai trò bảo vệ thôi. Nên là khi nào mà cơ thể chúng ta xuất hiện cái kháng thể HBs đó thì mới có vai trò trong việc bảo vệ, và cái kháng thể HBC thì nó chỉ có vai trò là cái marker trong các cái xét nghiệm chẩn đoán và không có vai trò bảo vệ các bạn. Vì lúc nãy các bạn hỏi như vậy cho nên cô giải thích sơ lại cho bạn về các cái loại kháng thể như vậy.
So look, the problem of hepatitis B is that some patients become chronic. Between 5 to 10% of patients will not recover. They will become chronic. We know this, we know that they have become chronic because the surface antigen is found in blood for more than 6 months. This is the marker of a patient with chronic hepatitis B, between 5 to 10%. But remember, this is not absolutely true because the rate, the likelihood, the risk of becoming chronic depends on the age of infection. In patients infected very early in life, newborns, most of them become chronic. However, in adult patients infected, very few of them become chronic. We have a vaccine against hepatitis B. So pre-exposure prophylaxis against hepatitis B is made by vaccination. This vaccine is recommended for all. This vaccine is recommended for all children. All of you have been vaccinated. This vaccine is given very early after birth, very early, in the first 24 hours of birth. This vaccine requires 3 doses, intramuscular. The second one after 1 month, and the third one after 6 months. All of you have received this vaccine. So all of you are protected against hepatitis B. The problem of hepatitis B in Vietnam, the problem of chronic hepatitis B is in adult patients, in patients around 40, 50, 60 years old, because they were infected before the vaccine was available. They were infected very early in life. They have been infected for many years, so they have a very high risk of developing complications like cirrhosis or liver cancer. So the problem is for those people. How to prevent the transmission of hepatitis B? Hepatitis B is transmitted through the blood, through sexual relations, and from mother to fetus. So infected people should use condoms during sexual relations, so safe sexual practices to avoid sexual transmission. Not to share razors or toothbrushes or other personal items. Obviously, not to donate blood or organs or sperm So these recommendations are obvious to avoid the spread. In this picture that you already know, we can show a summary of everything we can do to fight hepatitis B. For pre-exposure prophylaxis, we give the vaccine. The antigen that we use for the vaccine is the surface antigen, recommended for all children in 3 doses, as I told you. Post-exposure prophylaxis is also possible. We can do it with the vaccine and with antibodies. For people who were not vaccinated but have been exposed. And finally, we can treat patients with chronic hepatitis B. Patients with chronic hepatitis B must be treated with antivirals. Currently, we have antivirals to fight hepatitis B virus. Tenofovir and entecavir are the best, and also interferon alpha. This is not important for you now, but this will be very important in the future. Any question about hepatitis B before we continue with the next class? Any question
no.
related?
No.
So we continue with the next class. Okay, so we continue.